we can share it after the call. Start by introducing myself and how this meeting came about. My name's Julia Manzo. I am with Lutheran Disaster Response, which is a ministry of Liberty Lutheran Services, primarily in the eastern part of the state. I am part of Pennsylvania VOAD and Southeastern Pennsylvania VOAD. For those not familiar with that term, that's Voluntary Organizations Active in Disaster. There's a number of partners from VOAD on the call this morning and includes names that you're very familiar with, like American Red Cross and the Salvation Army, and maybe less familiar partners in disaster, many faith-based groups, many community organizations. St. Vincent de Paul Society is on, and they are going to be our primary presenter program today, and they are also a partner in VOAD. And just to give a little background of how this call came about today, there's a number of us who engage in disaster case management, and in Pennsylvania, we haven't had a declared disaster since Irene and Lee in 2011, but a number of us who engage in undeclared disasters, including Lutheran Disaster Response. So we work with especially PEMA on that effort, and more recently, even after Hurricane Maria and when Puerto Ricans were coming to Pennsylvania, and also with COVID on the human services side. But our primary partner has been emergency management, but more and more recently, human services as well. So with the Ida disaster event, a number of issues related to disaster case management arose very quickly, and the opportunity, the purpose of this call is to talk about the application on behalf of the counties from the state to the federal government for federal disaster resources related to case management. So counties reached out to some of us in the VOAD movement, some of us, myself, the Salvation Army, other community partners. There were lots of conversations happening. And so out of those conversations and in conversations with the state, seeming to think about what's a best practice, reviewing what are our best practices for declared disasters and disaster case management. And a number of us work in contexts around the country and so forth. And the best practice that from our VOAD movement is having a third party agency from the VOAD movement who is experienced with disaster case management on a large scale. There are several of those organizations in the National VOAD movement, and one of those who is a leader is St. Vincent de Paul Society, and they are going to explain the value of that third party effort in administering federal resources around disaster case management. So after lots of conversations and some trying to move quickly over the last couple of days, we thought it would be important to bring together this community to talk about how we as a state may approach this from that angle as far as using a third party to administer disaster case management and make the application to the federal government around that. So this is a presentation for your consideration. At the end of that presentation, there'll be opportunity to talk with state representatives and anyone else on this call among each other about, do we want to move forward collectively? What counties might want to move forward collectively? But just want to make sure there's plenty of time to get questions answered and come up with a plan to move forward should you wish to do so. That being said, my partner in this, getting this started, is I want to just make sure Carl gets identified here. Carl Jones is colleague in Pennsylvania VOAD. Ed Robertson is our Pennsylvania VOAD president. Carl and I were working with St. Vincent de Paul and putting this together. Carl, do you want to say anything before we get started?
No, just welcome everybody and thank you for being here.
Okay, great. So with that, Anthony and Liz, will turn over the presentation to you. I will share, Anthony, if you want to request.
Okay, let me get this set up. All right.
And I'll let you both introduce yourselves as well. While you're doing that, Anthony, I didn't think it was worth our time to go through and have everyone introduce themselves, but just if folks could put their name and contact information or any affiliation information in the chat. We have folks on from state government, from FEMA, from various VOAD organizations on the call today. want to make sure you have the opportunity to connect with each other after the call.
And good morning, everyone. And while Anthony's getting the PowerPoint up, my name is Elizabeth Disco Shearer. I'm the CEO of the Disaster Services Corporation of the Society of St. Vincent de Paul, USA. And I cover disasters across the United States and American territories. I'm also the vice chair of the National Voluntary Organizations Active in Disaster. As Julia said, St. Vincent de Paul has been active in disaster case management for a long time. We've been active in disasters in the United States since the early 1840s. So we're one of the old organizations in the country. And we've managed disaster case management programs. We've done cooperative agreements directly with FEMA. We've worked under states. We've done programs from 8 million to 70 million. We've been the lead agency in a number of states. We've been a member of collaboratives in a number of states. And so there's different models, but we feel like it's important to have a lead agency because of the importance of having consistency in reporting. So next slide, Anthony. And with me today is Anthony Placchino, who is our Chief Program Officer. So what the model would look like if we did something like this in Pennsylvania, we would report to the state, but we would also collect all the information from all of the counties and be responsible for whoever the county designated as their provider. And we would do a consolidated invoice. We would handle all the audits, the internal audits, and we would have a shared SharePoint portal where all the documentation would be available to FEMA and the state for any type of virtual desk audits or on-site audits. Next slide. So what are the advantages of having the financial side of the house done? And this is, a very complicated part of doing federal programs because we're looking at 2 CFR 200. It increases the performance outcomes and the oversight accountability. It increases the efficient use of resources and transparency. So instead of having, 6 or 7 entities doing different types of financial reporting, you have the same type of forms, you have the same type of processes and protocols. Everybody understands what the playbook looks like. It reduces waste, fraud, and abuse. One of the things that we do, we're currently doing a program right now with the state of Oregon, and we are the lead agency for the state, and we're managing these service providers and helping them to understand all the rules of working on a federal and state contract. But we also do a monthly internal check where we look at all the information on their general ledgers, the supporting documentation, making sure there's a functional allocation to the particular programs. And that provides assurances to the state and the federal government that all the organizations are working according to the regulations. And it also gives some comfort to the organizations that they don't have to worry about all the oversight on the federal regs. And it reduces duplication and conflicting guidance because we issue Q&As to provide that consistent information out to all the providers. Next slide, Anthony. So we do training on the front end to the financial points of contact on all the regulations and updates to the regulations. We create a tracking system and an audit trail for the providers and for the state, the federal government. And if OIG, the Office of Inspector General, comes in at any time, and on occasion they do test states, we have all that documentation available, and that can be easily pulled. And again, it's smooth and transparent. It also helps with the quicker processing of payments. One of the problems that slows down states on the processing of payments is if there's something missing, if there's an issue with documentation. If all that is vetted beforehand and the state gets a consolidated invoice, then the payment system is seamless. In Hurricane Harvey, we were able to do all this for 14 provider organizations. We provided the financial oversight in the Project Comeback Texas. And as a result of that, when the invoices were sent in, we were able to get funding within a 7-day period to the service providers. Again, all the processes were set up in the front end and training was done on the front end. And that's why it was such a quick process. There's less compliance and audit issues for counties in the state when you have this type of internal controls in place with the lead agency. Next slide. So the advantages, again, of having a lead agency for oversight, you have one group to coordinate the financial and the programmatic outcomes on behalf of the providers, and Anthony's going to address the reporting on the programmatic side. You have consistent messaging to survivors, so everybody understands what the process looks like going in. There's standard metrics to measure the outcome versus various forms and methods. We've seen in some states where you have a number of different providers and different systems, and it's very confusing because you may have a case transfer, for example, and there's different forms, and it really is frustrating to the survivors. The program can be quickly rolled out and geared up because of the experience of the lead agency, so you don't have delay time. It makes available a critical management resource for counties and for the disaster case management providers because there's one point of contact to go to. And it lessens the workload and burden to county and state officials because most county and state officials are wearing a number of hats in emergency management. And as we talked about previously, it provides a standardized model for building local capacity and for future disaster recovery. So we put these things in place, and then in the future, the local organizations are actually able to handle a model on their own because they've learned from the process. Next slide.
That's me.
So Anthony's now going to talk about the programmatic side. Anthony?
Thank you, Liz. My name is Anthony Lucchino. I'm the Chief Programs Officer, and I'm responsible for managing the different disaster case management programs throughout the country. So Liz talked about the finance and touched on the programmatic side. And what I'm going to do is on a high level talk about what's involved on the programmatic side. So as you can envision, you have different agencies or sub-providers or counties, and you're going to be seeing clients, and there's different types of data that you need to obtain and collect and vet. So you want to have some sort of a database environment that's able to collect and store that information and also be able to run reports and statistics. So some of the things you need to consider are what type of data elements are being captured, and that it would be looking at the different fields that would be involved that you're going to need for FEMA reporting. And we've been working, as Liz mentioned, with the states and FEMA in various types of programs throughout the country and in Puerto Rico. And we've had experience with different types of platforms. And then you want to decide who's going to collect that data. Is it going to be the DCM, the sub-provider, and how is that data? How is the data going to be collected? Is it going to be via laptop or a tablet? The other key thing that you want to consider when looking at a data environment, which is the identified duplication of benefits, and that's a huge component. And by having one database in which multiple sub-providers can access, that will be a check to make certain that there is no duplication of benefits. And the other thing, of course, was any types of databases, you want to have some sort of a backup. Two of the database platforms that we've used in the past years, one has been CAN, the Coordinated Assistance Network, that's managed and put out by American Red Cross. And the other is the DART system, D-A-R-T, Disaster Agency Response Technology. That has been put out by a company called VisionLink. They developed that product. That DART platform was used in the Harvey, Texas program, and in the currently in the Oregon DCMP program, they using a version of that DART program platform, which they call VisionLink. But the fields are basically the same. And so we've had experience with all of these different platforms. When you start looking at the DCMP process, so you have this database, you have all these different fields that are identified. And the process for DCMP, again, this is very high level, is that you first want to do outreach and screening and outreach to the community. And that can be done in various ways, whether you have special events or through the OEM. FEMA may be able to provide lists, VOADs, LTRGs. And then you want to perform the screening to make certain that they are eligible for the program. And once they are, you perform a intake, and that would be a multiple page intake asking them for a variety of questions. These are forms that we have developed over the years, which can be customized to any disaster. Interesting, what they've done in Oregon is they've taken the intake form and they've kind of mirrored it onto the VisionLink database and eliminating the need for paper, and they're putting the information directly into the VisionLink platform. So pretty much becomes almost a digital type, a virtual digital type of database, and the supporting documents are also digital. Once you have the intake, you want to look at the assessment and see exactly what the unmet needs are, see what assistance they have received previously from which organization. Again, identify what their unmet needs are, and then once you have that, develop in partnership with the survivor, the client, a recovery plan. And this way, the recovery plan identifies the goals and the specific action steps that need to be taken in order to bring the client to the new normal or through a recovery. Once that plan is put in place, then we look to monitor the progress. And that's done in several ways, through various interviews, but also through looking at the database. There is different metrics in there that we can set up to monitor not only the progress, but also the productivity of the DCM. And we're able to make certain that the client is being, there's a communication that's ongoing between the client and the DCM on a regular basis. And that's all based on a tier level that's set up. So this way, there are specific requirements as to how many times, how many communications the DCM needs to have with the client. And after the monitoring the progress and the recovery goals have been met, then with the DCM supervisor, the DCM, and of course with the survivor, they get together to make certain that their recovery plan and the unmet needs have been met, and then the case is closed out. Some of the documents that organizations will need when running a DCMP, and these are some of the key items, and we've developed these forms over the years, and when going to different DCMP programs, we're able to customize them. So first one is the intake form, and this is pretty it's pretty intense and well developed. and we'll look at all the different aspects, and you're looking at the different household members, whether or not they're employed, if there's a need for unemployment assistance, looking at what they owe, their income and expenses, and various types of other information, if they're a veteran, disabled, the number of members of the household, et cetera, and things like that. Then you have the release of information, and you need that. So this way, you want to have the authorization from the client to be able to take the data, put it into a database, and also share it with other organizations in order to get help for them. There's also a release of information from FEMA, and for those clients that have registered with FEMA, there's certain information that FEMA stores, and it deals with the individual assistance provided, any financial assistance. Also, it identifies whether or not the client applied for SBA loans, and also if they were eligible for ONA, other needs assistance. So that information is in there. So there's a form that you need for FEMA. Then we look at the case notes, and this is a very important section because you want to be able to put detailed notes in there. So if you have to transfer the case from one agency to the next, the other agency can pick up and look at exactly what has been going on. We don't put down personal information or any medical information, any specifics like that as to what type of medication that's taken, and you don't want to include the personal note. So that is an ongoing process with the case notes, and you want to document every communication with the client, and also any attempted duplication, any attempted communication with the client. Then we look at the recovery plan templates, and we have that on VisionLink, where we can identify the multiple goals for recovery, and we can document the action items and the progress of each. And then once it's completed, we can identify that the different goals are completed. And this is a way that we can that we use to monitor the progress and start looking at how many recovery goals were established. And as we go through the program, we can look at each of these recovery goals once they've been achieved, and we can kind of check them off. And then you have, when the program is ready, when the case is ready to be closed, there's various templates that we've created for closing letters, and that can be simply listing all of the services and that were provided to the agency, to the client. It could be a letter indicating that the case is closed because of maybe no contact if the client didn't participate. Also, you can use, we have transfer letters transferring it to a different agency, as well as introductory letter introducing the client to the DCM and the contact information. A key part of the DCMP program is the referrals and the services provided template we want to record, and FEMA looks at this very closely as to the number of referrals, number of contacts, and also the value of the services provided, whether it be for furniture, construction, household goods, and items like that. So that's something that we track, and we use VisionLink. We're able to track that. And then when you start looking at reporting on a monthly basis, there's two components to the monthly reporting, and one is a monthly narrative that talks about the key points and successes of the program for that month, any challenges, and any challenges by the staff and also by the client, any outreach that was performed by the organization, and then there's a listing of all the different meetings, workshops, training, and then there's also a list of the success by each of the cases on each of the clients, and that is provided as under the success tab. And then you have the programmatic, where there's specific statistics that are needed on a monthly basis, and I'll show you a sample on the next slide what that looks like. And then finally, when the program is over, we send out client surveys to get their input as to their experience with the program. You know, when we talk about the programmatic, here is a sample of the programmatic report that's due on a monthly basis, and you'll see some of the questions and some of the topics that we have to cover, things like clients on a waiting list, the number of contacts, and that can be communication, either calling them up or actually contacting the individual, number of case managers, supervisors. They like to look at the ratio of case managers to supervisors, and also case managers to clients, to look at that ratio. And then they look at the number of open cases per month and cumulative. Then they look at the female likes to look at the top 3 unmet needs. And we provide that on a monthly and a cumulative basis. And then there's a tier level 1 through 4, 1 being the least severe, 4 being the most severe damage, and generally those people are disabled or elderly. And we provide that information. And then the number of clients completing recovery plans, number of clients of cases that are closed, and then looking at the recovery plans completed, and then they also want to know where there is a recovery without or the case is closed without a recovery plan. And also important is people or families that are in temporary housing. And then there's other stats as to referrals and services provided, those with construction and without construction. So these are all this is a monthly statistics that need to be provided. And this is all obtained by using, as I said, we use VisionLink, and it's a report. We get an export of the report, then we're able to create pivot tables to go in and slice and dice the data. So this way, we are able to extract the numbers that we need. And then this would be accomplished if the different sub-providers using either the data analysts or the DCMs just simply maintain the case file in the VisionLink platform. And then later on, there's no computations or reports that the organization has to run. We take care of that. We run the different exports and able to extract the data and create these reports. And as well as doing that, we also provide data exception reports, where we look at the data and make certain that it makes sense, check the different dates, and make certain that there's data integrity within the database. This is a sample programmatic dashboard. So this is what the data that's stored in this platform, and this shows the cases that are open during the month, total cases in database, and cases that closed with reasons for closure. So this is the type of different information that you can gather while using the Vision Link database. As well as getting and obtaining data for the program and the statistics and the reports that I do, the data that we have in Vision Link, we're also able to track the productivity of the DCMs and also of the respective teams or sub-providers. So these are reports that we can provide, and we have provided them to our different partners and sub-providers in the various programs. So this way we're able to measure exactly what's going on, cases that are being opened and closed, and what each organization is doing. So we've talked about the reasons for going through a regional approach, looking at the financial and the programmatic side. And there's definitely some advantages to going that way, where you have a one source third party that will handle the finance and programmatic. And this way, combine that information, be able to send it up to the state and also to FEMA. That's the end of my presentation. Liz and I are willing to entertain any questions that anybody may have.
I'll start by just thanking you both for taking the time to prepare this and share this information with us. And also want to give, Steve, is there anything from PADHS that you want to comment on before we go to additional questions?
Probably do questions first, and then I'll do the summary of expectations afterwards.
Okay, great. So questions for Anthony and Liz.
Can we get a copy of this presentation? Absolutely. We'll send that out.
And I am recording it, and I plan on getting that downloaded, and we can send that out with a copy of the presentation as well. Other questions, comments? I have a question for either of you. When you talk about, just the overarching kind of third-party role and the functions that that agency can play, then what does it look like kind of on the ground within a county? Can you talk about how you utilize local resources and how those are engaged in this process and how that might look?
Yeah, so I'll start, and then Anthony can augment. For example, the county would have providers, Julia, so they would determine who those providers would be. We would provide the forms and the training to those providers. And then we, on the financial side, because I usually oversee with our team the financial side, because that's my area of expertise, we would have find out who the financial point of contact at the county side is, and we start off with having weekly meetings on the initial rollout, and then we go to monthly meetings. But we would work hand in hand with those organizations to help them, and we would set timing of when the invoices would come out and work through with them their first invoice, notify them if there's any problems with any documentation, set up a shared portal that all information can be uploaded into. So it's a very much a working together process. because we have the experience, as I said, we can easily gear up for this type of program. And we've done it in numerous models. We've also done the reporting on the financial side directly to FEMA, where we've filed the federal reports that are done, and we worked with the payment management system. So we understand what the state has to go through too. We're sympathetic to that. And we make sure that we have all the documentation that's needed so that there's no issues on reconciliation. So it's very seamless for both the state and FEMA. Anthony, from the programmatic side?
Yes, the benefit is you have an organization that has the experience working in different programs. So when you start to look at the learning curve, it becomes shortened. So this way, you're able to get up and running. Many times organizations, when they don't have the experience in starting up at DCMP, they're looking around for the forms and the process procedures to put in place, looking at a database that they need to employ. And so with us, we're able to come in with a core team and look at the local capacity, the capacity of the local areas, and be able to hire people within the local organizations, local communities, and we're able to train them, and then also get them up to speed and look at not only the forms and the DCMP process, but also the database. And this way, each of these local communities are building capacity, and then we provide the oversight on ongoing. Also, we provide ongoing training, and one of the things that we look at is when we're having weekly meetings, monthly meetings, being able to identify some of the needs that they have in order to do their jobs. And also by looking at some of the data that we collect in the database, we're able to look at trends and identify areas of weakness or where there needs to be some improvement and some more education.
Thank you. Others?
Julie, you posed a question earlier if the decision was made to go as a regional request for the DCM program. Would the state assist in that application process? Yeah, we'll assist any way we can through this process. Unfortunately, we haven't heard a whole lot of feedback from the declared counties yet on what their needs are to move forward. We've had about 30 days, actually more than 30 days elapsed now since the declaration went into effect. So we're 30 days into a 90-day deadline that we were hoping to be able to meet within about 45 to 50 days. That likelihood is diminishing as we speak. And the reason we wanted to expedite this was in order to get the services available as soon as we could to the individuals who were affected by the disaster and are in need of this program, especially because there is no immediate disaster case management program available for FEMA right now. So with that being said, we want to help you in any way we can through this process, but we're not quite sure where the assistance is required at this point. So we do need some feedback along those lines. Both ourselves, if you choose to go with, a lead agency like is being suggested by the PA VOAD, and I really thank the PA VOAD for, assisting in finding someone who may be able to serve in that role. If you choose to go that route, they may be of assistance in your application process as well, as they've indicated. But time is winding down here, and we don't want to be in a situation where we're close to the deadline and you're your particular county chooses not to participate because they feel as though they can't get the application information in time to the state. The state requires about 15 days to condense all of the information that it receives into one application for the state. And like I said, unfortunately, at this point, we're not quite sure the direction in which anyone's taking. We would like to hear from each county within this week to make a determination on how they plan on administering their program and the design of their program. And the final information is due to the state by the 29th of this month. If we do not hear from you by the 29th with all of your needs assessment information and other application information such as budget and a programmatic design of your program, we will make the assumption after the 29th that unfortunately you weren't interested in the program, and we really hope that's not going to be the case.
Thanks, Steve. I did raise that question to Steve, and just to reiterate what I'm understanding, or just speak that back to you, Steve, that if counties want to approach the application and the implementation of the federal disaster case management resources through a third party and working together with one other county, several other counties, if they express that desire to you, the state is happy to help make that application from a regional perspective, whether it's 2 counties, 6 counties, 8 counties. Is that correct?
That is correct. No matter how many meetings are required to do that, whether they're in person, whether they're virtual, whatever, yes, we'll be happy to get with you and work through that process of simulating all that information needed as part of the application process. It's not a problem at all. And we do welcome that regional collaboration. It really makes life easier because some of that condensing of information would occur then before everything is turned over to the state, and it should make for a quicker submission process on our end later.
And this is Carl. And Liz and Anthony, I think you indicated you would be able to assist also in that application process. Could you just describe what that might look like so the counties have a better idea about what that might look like?
Yeah, so we would work with the counties on collecting all the demographics and the data, Carl, and then we'd also need to know who they are looking at as the provider. If they've done some pre-vetting of organizations, so that we could put together a report that would show consolidated on who the providers were going to be for the various counties. We're making the assumption that there's already some providers, some human service providers or social service providers or VOED organizations or faith-based groups that various counties are currently working with on Hurricane Ida recovery. But as has been indicated, there's a short timeline. We need to be able to pull all this together, and it's quite a comprehensive application process.
Can we get any feedback from the counties on direction you're thinking of heading? I think from a voluntary agency perspective, we see the value of having these federal resources and really hope that they can be provided to the survivors from Ida in Pennsylvania. Just want to try to get a pulse of where counties are and their thought process on this, if anybody's willing to share.
Hi, Julia, it's Joanna from Montgomery County. So we've had a lot of internal conversations regionally with the other counties in the SEPA region around this. As I know, I think you've been part of some of those conversations. And last I checked, there were several counties that were interested in pursuing a regional provider. I know Philly, Delco, Chester, and I have all had different conversations at different times about what that looks like. And I think I also reached out to Bucks and we talked a little bit I know some people were waiting, or some counties were waiting to see how this presentation went today, but it did sound like a couple of counties have less of a need maybe than we do at Montgomery County. And then I would say we're probably followed closely by Chester. And I did talk to Chester, I guess, at the end of last week. So I know we were, again, waiting to see how this presentation went today to then reconvene as a regional group and figure out, who is looking to move forward with this regional provider model and who isn't, and then get started on whatever joint application pieces are necessary to get this up to the state. I don't know if anyone else from the any other EM county representatives want to chime in on that.
Yes, this is Bill Turner from Chester County. Just echo what Joanna said. We have a meeting right after this call with our county human services and community development to kind of figure out next steps here. We're anxious to hear this presentation and kind of have that next step discussion after this. So hopefully we'll have some idea, but we're definitely interested in a model of bringing this in, whether that's regional or county based, whatever works best. But we're definitely interested.
Thanks, Bill. Thanks, Joanna. So there's some natural regional already existing infrastructure, for here in southeastern Pennsylvania. We have some task forces, so there's natural kind of collaboration there, but just want to also make sure the other counties that may be on this call from outside of southeastern Pennsylvania know that there are this suggestion is open to you all as well. And I think the best thing to do is at least let Steve, at the very minimum, if you're interested, let Steve Michaelone know that you are interested in that. If you are interested, to let him know so that those conversations, anyone who's interested can be part of those conversations. Unless Steve, you have other direction on that.
Oh, that would be great. And just hearing that these conversations are occurring gives me some hope in this situation, because I was worrying what was going on since I hadn't heard anything for so long. So thank you, Bill, and thank you, Joanna, for letting me know that this is still an open discussion point that may be wrapping up here soon. I greatly appreciate that, and knowing that there is work being done behind the scenes still to move this forward. So thank you.
Steve, Mike Murphy from Chester County. I think we danced around this question the other day, and it's come up a couple times today, but nobody's asked directly. While we all agree a regional approach is great, is there an opportunity for the state to, when we do this regional application or whatever it's going to be, to do the procurement, or is each individual county going to be a grant recipient and then have to establish the St. Vincent de Paul folks as vendors and do our own contracts? That's really where I see the time problem is going to come into play here.
Yeah, understood. And I'm sorry, I didn't realize that was being danced around. The state would prefer to do either a sub-grant or a procurement through a single vendor rather than having to put each county through that process. It's easier for, I think, everyone involved. And we would like to go down that path if a regional approach was going to be chosen by all the parties involved, or at least the vast majority of them. We're not going to force that. That's going to be up to every individual one. Please keep in mind that the actual service providers are going to probably be your local vendors that are already engaged in case management, or additional ones that they would be bringing to the table. And that basically what is being presented here is that there is just a management agent being brought to the table to coordinate everything between the multiple other entities that would be involved in the casework that would go on. So no, we have no issue with that, and probably would prefer it actually that way. Dealing with one vendor versus having to do multiple sub-grants to each county just is a much simpler way of doing business.
And probably a lot quicker. Thank you very much.
Absolutely, Mike, and thank you for bringing that up. If that was an underlying question that needed resolved, I appreciate that.
Julia, I don't know if it would be helpful for you or for Carl to talk about what the VOAD support or regional partner support looks like in the two different scenarios, right? So one of the biggest reasons why we have said we're interested in the regional provider is because we know the other scenario may tax our VOAD partners and spread them too thin. Our regional provider lets us kind of work equally with VOAD partners, but I don't know if you want to talk more to that, since this seems to be kind of a decision-making meeting for the rest of the counties on the call, if you think that would be helpful.
Well, I saw you take yourself off mute. You want to take that first?
Yeah, again, this is Carl. It's a very good question, and I think for this particular response for this disaster, since it is declared and because we do have the federal resources available in the DCMP, that it changes some of the ways in which we've been doing business over the last 8 or 10 years when it's come to more localized events. So where VOAD agencies, one way or another, have been able to support the efforts of rebuilding, in Eastwick and after the July 12th flooding and in other kinds of regional events, and been able to do disaster case management relatively well, we don't have the capacity to support this kind of effort. Nor do I think that we need to do that since on the federal side is available. It's one reason why I'm grateful that St. Vincent de Paul is willing to be involved with this effort. And Elizabeth, I'm glad that you haven't really had a lot of experience in Pennsylvania before, so we're really glad that you've kind of come to the table on this one. Does that help to answer that question? I just don't think we have the capacity, nor do I think that we should have the capacity for this particular event, since we have this resource that's available to us.
Yeah, and Carl, I'll just say we haven't done the been an oversight or done the disaster side, but our local St. Vincent Falls are very active in the state on a daily basis, dealing with poverty issues. So.
But we can have another discussion at some other point in time, Liz. You're technically not a member of PA VOAD, so we can have a talk about that with our membership committee someday.
Joanna, really, I think Carl said that very well on behalf of VOAD agencies as one of the groups that has been providing the case management for the undeclared disasters. I could see us as Lutheran Congregational Services being able to support some of the work in 2 communities or something like that, but not to the degree that we're talking about with this resource. And to Carl's point, it's a resource that we don't often have available, and we want to take advantage of it for the survivors, or we feel that it would be a lost opportunity if we didn't collectively take advantage of it as communities. So I'll leave it at what Carl said in that regard. Does that help answer your question, Joanna?
Yep, it does. Thanks.
And the other piece of that is that if we take advantage of this resource, that means that money that necessarily that our VOAD agencies might have spent on disaster case management, we have available to do housing rehabs and do other things for the survivors. Because our pot is only so big, so this increases our ability to help more quickly the survivors and to help them in a bigger way. And the other side of that, I'll just put on the table, is besides alongside of the development of the disaster case management program, would also be the development of long-term recovery groups, whatever we're going to call them, and whatever shape they're going to take. But that's another effort that's going to have to go on side by side with the DCMP. And so if you decide to do this kind of a way, do DCMP in this way, that means some of the other VOAD agencies can help to support the LTRGs a lot quicker and probably stronger.
Great point, Carl, and completely agree with that. Anyone else have anything they want to comment, ask before we reiterate, next steps and kind of what needs to happen next? All right, so my understanding is then, we'll share this presentation. I think Anthony just sent me the slides. I'll get the recording situated and get this out to this group. And honestly, this group is bigger than my initial invitation list. So you all, if you forward it to somebody who's on this call today, please, if I'm not getting it back, can you check out the distribution list and make sure if there's people that you invited that they get the information after the meeting. I might be able to glean that from the recording as well, but if you could help just distribute that, that would be appreciated. Encouraged to hear that there's some regional conversations still happening. And if you can share with us anything you need from VOAD, from PADHS to continue to move forward, that would be appreciated as well. And then also, I think, any questions about a regional approach or regional support for a regional third-party provider, I'm happy to play a conduit role, but I think it's really going to Steve at PADHS, Steve Michaelone, and directing those and keeping him in the loop about what you would like, what support you need, and we'll take it from there. Any closing remarks, Steve, that you have?
No, I think you hit it very well. Thank you, Julie. I appreciate that. Again, the state just wishes for this process to move along and to be able to get these services out to your residents as soon as we can. How you go about it is your prerogative, and we're letting it up to you. We just ask that those decisions be made in a timely fashion. And thank you for entertaining this meeting today, Julie. We greatly appreciate it.
And last thing I will say then is thank you, Liz. Thank you, Anthony, for taking the time. And thank you, counties and other stakeholders for being on the call today. Thanks, everyone.